Hello, dear friends. Good morning. Today I am going to start a new topic on surgical disorders and scope of homeopathy in surgical disorders. So today topic is Dr. Hahnemann's teaching on surgical conditions. What is his views? Let us see. As per the homeopathic concept, disease per se is nothing more than an alteration in the state of the individual. As per the homeopathic concept, disease is nothing more than an alteration in the state of health of an individual. This is caused by the dynamic action of external inimical forces. Alterations in normal condition is caused by dynamic action of external inimical forces upon the life principle or our vital force of the living organism, known by perceptible signs and symptoms. When alteration in our normal health starts, we know about signs and symptoms. Homeopathy broadly classify diseases as dynamic disease and local maladies. In homeopathy, diseases classify into dynamic disease and local disease or local maladies. Surgical conditions are a part of the local maladies in which surgical intervention may be essential or required. Injury of all kinds like accident, bone fractures, deep contused lacerated wounds, serious abnormal growth, bullet wounds or cuts that arise due to mechanical causes need to be treated surgically. Surgical intervention essential in cases of injury, accidents, deep contused lacerated wounds, serious abnormal growth, bullet wounds or cuts. Surgery is indicated in certain cases like tumors in advanced stage with strong pressure symptoms. Every tumor, a stricture or obstruction that do not respond to a treatment but threatening of life of the patient requires surgical intervention. Kidney stones impeding the urine flow and affecting the function of the kidney due to blockage should be mechanically removed. Surgical intervention might be indicated too concerning a uterus prolapse of third or fourth degree or an inguinal hernia which threatens to strangulate. So, in these conditions, surgical intervention is required, like in kidney stone or prolapse of uterus or inguinal hernia or gallbladder or any internal viscera which have cirrhosis developed or destruction started. Our Gita, that is organon of medicine, in aphorism 186 of organon of medicine, Dr. Hahnemann described the homeopathic approach on surgical conditions. Those so-called local maladies which have been produced a short time previously solely by an external lesion still appears at first sight to deserve the name of local disease. The treatment of such disease is relegated to surgery, but this is right only in so far as the affected part require mechanical aid, whereby the external obstacles to the cure, which can only be expected to take place by the agency of the vital force, may be removed by mechanical means. That is, by the reduction of dislocation. Examples are by the reduction of dislocation, by needles and bandage to bring together the lip of wounds, by mechanical pressure to still the flow of blood from open arteries, by the ligature, by the extraction of foreign bodies that have penetrated into the living part, by making an opening into a cavity of the body in order to remove an irritating substance or to procure the evacuation of effusion or collection of fluid, by bringing into opposition the broken extremities of a fractured bone and retaining them in exact contact by an appropriate bandage, etc. He further states that, but where in such injuries the whole living organism requires, as it always does, active dynamic aid to put it in a position to accomplish the work of healing. Examples are when the violent fever resulting from extensive contusion, lacerated muscles, tendons and blood vessels required to be removed by medicine given internally, or when the external pain of scalded or burnt parts needs to be homeopathically subdued, then the service of the dynamic physician and his helpful homeopathy comes into requisition. So, in this way, we see in this video what is view of our Hahnemann in treating the surgical cases, or in which condition homeopathic medicine helpful for maintaining the or minimize the pain or suffering of the patient, cases related with the surgical intervention. Thank you for watching. Like, share and subscribe.